Hello, I'm John Kanellopoulos from Athens, Greece, clinical professor of ophthalmology at NYU Medical School in New York. And it's my pleasure to introduce to you our culture protocol for our ambulatory surgery unit here at LaserVision Institute in Athens, which we think is a novel, thorough way to evaluate all sides, all aspects of possible microbial contamination. This is a quick view from our laser suite. This is our YAG green light laser, and this is our sterility cabinet for the laser suite only. Everything happens here with the statin sterilization device, and I'll walk with me and I'll show you. This is the clean shoes section. So from here on we go scrubs only, and we're going to enter the higher degree sterile area. This is the circulating area with the area that we wash our hands before the surgery. This is our defibrillator standing by. We'll go into the sterilization room where this is the refrigerator with all the disposable materials that we use. This is the main sterilization unit, another statin unit, and this is now the room that we use to sterilize the all the equipment and instruments from our more sterile techniques such as cataract, glaucoma, and general intraocular surgeries. So this was a level 2 area in our study. This is the smallest third room that also acts as a step down for patient monitoring and peribulbar anesthesia. This is the second cataract surgery room, and as you can see, phaco machine, microscope. We culture here the floor, the tabletop, the air with a system that will show you, and the ventilation system with a system that will show you. This is our cataract surgery suite, and also vitrectomy suite, a constellation by A.John, the Lensix used for cataract surgery, operating microscope, anesthesia monitoring devices, our videotaping devices, and again, while we're finishing up with this gentleman, penetrating keratoplasty, the floor, the cabinets, and the air is cultured here. The goal of this study was to evaluate a protocol of culturing all surfaces, culturing the air, culturing the ventilation system, and culturing a large sample of our patients, conjunctiva and nasal mucosa, as well as all the staff involved in surgery. Surgeons, nurses, technicians, even the cleaning staff. These are the blueprints of our operating suite. You can see starting from the bottom left, room 14 is our laser room. Room 15 is our main cataract surgery and Lensix room. Room 16 is our second cataract room and fundus room. Room 17 is the pre and post room, sterilization room. Under that, the corridor and the patient changing rooms. Okay, and this is the protocol with the physician from the Pasteur Institute. That was a certificate, and now we're preparing here the air sampling device. You can see that everything's sterile. We have two different discs to culture. One is a tryptic soya agar, or otherwise called PSA for bacteria, and the other one is Sabarod's petri dish for fungi. You can see them here lined up, labeled. Some are placed on the surfaces to measure sedimentation of material, and some by touch, as you saw before, on the door and on other instruments. Here we're inserting the culture material on the special device, which is used by the Pasteur Institute in Athens to sample air. And you can see the device in action here, sucking in the air and filtering that air and culturing it. So we're now, after 4 hours, taking out the petri dishes, and these are the results. You can see the scoring for eyes should be on the bottom between C and D, and our surgical rooms scored closer to B, which are for regular operating rooms. Our patient preparation areas scored between C and D and are the yellow. And of course, the corridors are the non-sterile areas. So this is the basic principle of our study. We used cotton swabs, sterile cotton swabs, and culture material to obtain cultures from all of our patients. We obtained a conjunctival tearfilm culture and then impregnated the culture media. You can see here blood, sabrods, and thioglycolate, as well as chocolate petri dishes, and send them for culture as well as the culture material in here in order to isolate the normal flora of our patients. We did the same thing then from the nasal mucosa. So we'll show you, it's a very easy documentation. We did this on patients and our operating room staff alike, including the surgeons and myself. So let's go to see at first hand the way we obtain the cultures from our patients. I will use the sterile cotton swab. Come here to our patient. I'm going to kindly ask her to look up. We're going to hold the lower eyelid down, and I'm going to carefully just obtain some conjunctival fluid from the lower conjunctiva. And we'll take the sample, we'll impregnate the petri dishes, again chocolate, blood, sabrods, and thioglycolate, and the culture medium from the cotton swab to be analyzed in the laboratory. And this was done by the Pasteur Institute here in Athens, Greece, one of the most prestigious microbiology labs in Europe. Then the second sample was obtained from the nasal mucosa. Obviously, this is not as relevant for the patient, but we felt it was very relevant for us, the operating room staff, as this is material that may be flying in the air. We went to the nasal mucosa and we tried to take a good swab, and that's it. Go back, impregnate the petri dishes and then the culture material. And we use the same technique on all the surgeons in the operating room, our nurses, our staff, our technicians, in order to be able and have a full spectrum of all the people that get involved with our operating room functions here in the LaserVision Institute in Athens, Greece. And these are the conjunctival results from staff and patients alike, showing the usual suspects and their sensitivities, and now the nasal flora. Again, most of the isolates sensitive to chloramphenicol and Vigamux, which were the treatment of choice. So I hope you found this protocol and technique interesting. It's my pleasure to have shared it with you. This is John Kanellopoulos signing out from here at the LaserVision Institute in Athens, Greece. Thank you very much for your attention.